So good evening all. My study topic is patterns of diabetic macular edema with optical coherence tomography. As we know, the diabetic macular edema is the major cause of vision impairment in patients with diabetic retinopathy. The multifactorial breakdown of inner and outer blood retinal barrier breakdown leads to accumulation of fluid in the neurosensory retina, causing intraretinal and subretinal fluid accumulation. The spectral domain OCT gives, it's a non-invasive imaging technique that gives high resolution retinal images and precise retinal thickness, and the initial visual acuity is the most reliable indicator of visual recovery in patients with diabetic macular edema. So aim of my study is to describe different patterns of diabetic macular edema and to study the correlation between the central foveal thickness and best corrected visual acuity. So my study setting is Department of Ophthalmology in Government Medical College Thrissur, and it was a hospital-based cross-sectional study, and study duration was 1 year. The study population of my study include the patient with clinically significant diabetic macular edema attending in ophthalmology OPD and retinal clinic of Government Medical College Thrissur. So inclusion criteria is the presence of clinically significant macular edema defined by early treatment diabetic retinopathy study. So my exclusion criteria were patients with media opacities, patients who received intravitreal focal laser or pan-retinal photocoagulation, and patients with traction retinal detachment or vitreomacular traction, and uncooperative patients are also excluded from the study. And study's sample size was calculated based on the study of Tomohiro Otani, and it was calculated based on this formula, and it was found to be 108 eyes. And study procedure, and we taken a detailed history after informed written consent, and the ocular evaluation will be done after in selected patients, and best corrected visual acuity was recorded in Lockmar unit, and slit lamp examination was done to rule out any media opacities or other ocular disease, and fundus examination were done with 90D lens and indirect ophthalmoscopy. And this is the definition of clinically significant macular edema defined by ETDRS. So, spectralis OCT was performed in all eyes with clinically significant macular edema, and patterns of clinically significant macular edema were studied and CFT were measured. And the data analysis was done by using frequency and percentage, and the association was analyzed using Chai-Quir's test, and p-value less than 0.05 considered as statistically significant, and it was performed by using SPSS software. And coming to the result of my study, the mean age of our study was 55.8 plus or minus 8 years. Mean duration of diabetes was 11.2 plus or minus 5. And these are the study variables of the study participants. It includes 35 males and 22 females. And the patients with mild NPDR with CSME was 5, and moderate NPDR with CSME was 41. Severe NPDR with the CSME was 7, and PDR with the CSME was 4. And this is the distribution of OCT pattern. In our study, the 44 eyes had diffuse retinal thickening that comprises 52.4%, 24 had cystoid macular edema, and that comprises 28.6%, and 90% had cystoid macular edema plus serous retinal detachment. And this is the correlation between the CFT and best corrected visual acuity. In 84 eyes with diabetic macular edema, the CFT and best corrected visual acuity had moderately negative correlation. And this is the graphical representation of correlation between CFT and best corrected visual acuity. And in correlation of CFT and best corrected visual acuity with the cystoid macular edema, it was found to have moderately negative correlation. This is the correlation between CFT and best corrected visual acuity in patient with a cystoid macular edema. Coming to the discussion part, and the diabetic macular edema exhibit 3 morphological patterns. The most common OCT pattern is diffuse retinal thickening, followed by cystoid macular edema, then cystoid macular edema with serous retinal detachment. This is in agreement with Otani et al. Study and Singh Lakshmi study, and we found significant correlation between CFT and best corrected visual acuity. That is, there is moderately negative correlation. This is comparable to the study conducted by SAD Diabetes Research Center. In eyes with cystoid macular edema, there is also a moderately negative correlation. In Tomohiro Otani studies, the eyes with and without cystoid macular edema, an intermediate negative correlation is seen between CFT and best corrected visual acuity. Coming to the conclusion, 3 morphological patterns were observed: diffuse retinal thickening, cystoid macular edema, and cystoid macular edema with serous retinal detachment. And best corrected visual acuity had moderately negative correlation with the central foveal thickness. And limitation of my study is other factors that contributing to decreased visual acuity are not studied, and less sample size. And these are my references. Thank you.
With this morphological pattern that you have described, how is it going to help in your treatment? You saw this the various patterns, right, in the OCT. So how does it correlate clinically? Like, what are you trying to achieve here?
Because we also correlate the central foveal thickness and best corrected visual acuity, because initial visual acuity is the most reliable indicator of visual recovery in diabetic macular edema patients.
So it would guide your visual prognosis.
Prognosis, yes.
Okay. Treatment wise. Why no?
So we excluded patients who received treatments.
Yeah. Yeah. So, and did your study, was your finding similar to the other studies in literature? That it's only the cystoid findings which
because
correlate
those patterns with cystoid macular edema has the highest correlation with visual acuity and central foveal thickness.
Your study.
That was my study.
What did the other studies say?
And those study, they have same correlation between without cystoid macular edema and with the cystoid macular edema.
Okay.
Yes.
All right. Thank you.
So with the last presentation, the Hall 5 session is over for today.